Sure everything is coming in well. I'm just going to do a quick test on this other screen here and make sure that my sound is coming in. All right. Yeah, it is coming in. All right. So I just want to make a quick announcement. And I realized some of you are asking, why are you talking about dental so much? And I wanted to address that because I'm not crazy about dental. I didn't just wake up someday and decide, hey, I want to, talk about dental every day for the rest of my life. No, that's probably the farthest thing from the truth. I actually was in dental about 7 years ago, and I left because I just saw the writing on the wall, and I didn't really see the business of dentistry going very well. And if the business part of it isn't going well, then the patient side of it, can't last too much longer either. So the reason why I'm talking about dental so much right now is because it truly is the number one most important thing for you watching it, especially if you have a mouth and you still have teeth in it. But whether you have teeth or you don't, whether you want teeth or you don't, hopefully you do, because it helps people chew, right? It helps me chew. But I say that because when I go into some certain towns or some certain areas, I see a lot of people without teeth. And it's not that people don't want teeth or don't want a healthy body. It's that we all know here in America, we have this insurance system that's like employee sponsored, right? And it divides the medical and dental. And we use this word dental, this 6-letter word that begins with D and ends with L. We use it as a reason and an excuse to deny and not cover or treat the mouth. Now, what I want to share here is that everybody knows everything here on this slide, but I'm going to put this together in a way that will be very helpful for you, especially if you're living in the US. I'm going to emphasize this is probably the most important thing that you'll understand about this system. So for me, before we get into the rest of this presentation, and I'm going to try to keep it as short as possible, under a couple minutes here, but just know that you can get help and you can see a dentist and you don't need dental insurance. In fact, dental insurance isn't even really insurance anyway. It doesn't cover you for any of the work that you really need in your mouth. So it doesn't help for your dental health. Unless if you are, there's like 2 plans that actually pay. But besides that, most dental insurance plans aren't covering more than about $1,000 or $2,000 a year. And if you ever needed real work at a dentist, that doesn't even cover one tooth, let alone your whole mouth. All right, so the biggest question that I want to ask here today in this dental is medical and why dental is the most important part of your health and your mouth is because we are now, we've known for a long time, but it's coming front and center. I think everybody is starting to realize that 70% of all heart disease and breast cancer starts from the mouth. At first, that might sound like a surprising statistic, or it may even sound shocking or alarming. I know it did for me because it clicked something in my mind. I had just recently lost my father about 5 years ago, and so I had been pondering about this topic. How could my dad die so soon if he was seeing the top doctors and being told that he was being given the best care? How could he just suddenly die and, there not be an answer? They said that it was undiagnosed heart disease. How can heart disease be undiagnosed? That means not found, right? And how could it be heart disease in the first place? Does it just start there? Well, no, we're finding out that in 70% of the times we're proving it, but overall in the body, actually 9 out of 10 times, so 90% of all disease, infections, or health problems start from the mouth, whether it's from something we eat, we drink, toxication or some chemicals that we put into our mouth knowingly or unknowingly, and then the infections. So if we have, oral health or, cavities, any kind of, sugar, things that we just let throw off our body. And now it might start off with something as simple as sugar, like I just said, but it can turn into something like a cavity or infected root, tooth, jaw, gum, mouth, and more. I mean, I've seen some people that go to an ER and they literally have a balloon, it looks like, in their throat. So much so that in some cases it's almost crushing their windpipe and they're not able to breathe anymore. You can even hear it in their voice, like you can kind of hear there. And there's nobody there that can really help the patient in most cases. I mean, most doctors in the hospitals are focused on, getting the really high cost surgery and all of that treatment done, that they forget or they're actually told not to look in the mouth. But 7 out of 10 times, or we're finding out 9 out of 10 times or more, if they just had a dentist to pull that tooth, in just a few hours or in just a few days, that swelling, that inflammation and that infection goes down. And once that goes down, all of the other downstream problems also tend to go away. I mean, we're seeing health problems ranging from diabetes is one of the ones that comes up on the list all the time. I mean, even obesity, right? People think that, just being overweight, it is a very, direct product of our, heavily processed food system. But even if you are eating a healthier diet, but you still have problems with weight, and it's not just, physical things, it could even be mental, psychological, because the mouth is so close to the head. It makes sense because our blood does circulate, right? I mean, we've progressed far along the medieval times when we used to think that our blood just sloshed around in our bodies. So, now that we know that dental is medical and dental is the most important part of your body, if you're a dentist watching this video, I'm going to be releasing a summit, and it's going to be live. I'm not sure exactly how or what channel I'm going to do it on, because this is going out on a few channels, but find my YouTube. It's going to be Dental is Medical. This is for the dentist. If you're a patient and you want information there, just go to Health Starts From Mouth MVMT. That's what that stands for, is hsfmmvmt. I'm now realizing just right now that that's not the easiest thing to remember or write down. But if you just do it right now before you forget, it's Health Starts From Mouth Movement. That's what that stands for, hsfmmvmt. That's for the patients. If you're a dentist and you want our live summit, I'm just going to be live streaming this summit. We used to do live events. We're going to be doing more live events, but I'm in the middle of opening practices and opening new locations. And I wanted to get this information out there and didn't want a location, to slow that down or stop that. And so for the patients too, patients, you can bill. And really I was just having a conversation with one of our doctors this morning. He was going to get a crown. So this is, all dentists are also patients themselves, or rather we want to avoid being, being a patient or being in the chair by having the best health that we can. But all of that starts with, if you're a dentist, please, and if you're not, send this to your dentist, or if you know one, make sure your dentist watches this video or the summit videos, because it's all going to be free. I'm not going to charge anybody for this, but this will be the most important information for your dentist to learn, or for you as a dentist to understand, because this summit will show you how to do a couple of things. Definitely to increase your fee schedule to get paid your full money that you should be collecting as a doctor. But I think the one bonus that I'm going to be sharing with you over the summit would be worth it alone. Like, for example, one of our other doctors, if I can show you exactly the steps, and there's only a few steps to do so, but how you can get a check of like $100,000 or more. And goodness, I don't know any dental check I've seen ever exceed that amount. But this was just for patients and treatment that the doctor had already done before they ever even met us or had learned this program. And they had done 110,000. That was their first check. And that wasn't even for all of the patients' claims that we had sent off. That was just for the first batch. So this is very powerful stuff. If you're a dentist seeing live patients, you absolutely should do this. Make sure you sign up. I know it's on multiple platforms. It's not I just wanted to get this information out there. So, make sure you sign up, like, share, DM me, ask for how to find the summit. But it's going to be on the Dental is Medical channel. It will be on YouTube. I'll be streaming on there for sure. And I will do my best to, get it out to these other socials as well. But make sure you don't miss it. It'll be life-changing for any dentist on the call. The next 10 to 15 years are going to be the most incredible years for your life as a dentist, and we're seeing incredible things on the patient side as well. So I'd like to help you get your money. You deserve it. You earned it already. You probably already did the work, and I'm just going to help you collect it. So if you're interested, let me know, and we'll see you on the next videos. Take care. And we'll